Hi, thank you for joining us for today's webinar on supporting LGBTQ survivors of sexual violence, foundational concepts for service providers. I'm Timothy Elliott, and I'll be the presenter today. I want to say a deep thank you to DC Coalition to End Sexual Violence for asking me to come on and for making space to talk about such an important topic. Our webinar today will be about an hour long, and it is pre-recorded, so I invite you to pause it, rewind it, fast forward, take care of you in whatever way that needs to look today. Some of the concepts and information we'll be going over may be a review for some. It may also be brand new. So I welcome us all to take this as an opportunity to deepen our own understanding and reflect on the work that we do, ultimately striving to provide better, more affirming services to all who seek us out. Here's my contact information. I'll have it again at the end of our webinar today. Feel free to reach out to me. We only are here for an hour, and I understand the topics we'll be going over are so nuanced and complex and diverse that I want to offer myself as a resource as you're going through and maybe looking for an additional information, research, strategies. Always feel free to reach out. Just a disclosure statement that DCCESV has hired me to develop and deliver this webinar, but I do not have any other financial or conflicts of interest outside of that could negatively or adversely affect what I'm presenting on today. So here is a basic rundown of some of the objectives that we'll be going over. First, we'll spend some time talking about language and why it matters, kind of reviewing basic concepts, terminology that can help us understand LGBTQ identities. Second, we'll talk a bit about some specific barriers that LGBTQ survivors face while they're accessing services or even coming to the understanding that they need something or something could be helpful. We'll also look at trauma-informed approaches and specifically some strategies that can promote access to services for our LGBT community members. And then lastly, we'll review a few both local DC-based and national resources specifically for LGBTQ individuals. I want to start with this quote by Alok, who they are a fierce advocate, writer, and comedian. If you're not familiar with their work, I highly recommend it. They say, language has the power to shape our sense of self. When we are named correctly, we are seen. One of the things that I've come to understand in doing this work, primarily with the LGBT community for the last 15 years, is that isolation runs deep. And so much isolation is based on when people don't see us, don't use language, or don't even understand the importance of that. So I like this quote because it really just solidifies for me that specifically for any community, especially communities that do face significant oppression, the language we use has power. And it has power both on a community level, but also, and maybe more importantly, on an individual level. Excuse me. So we'll start with defining some concepts. One thing that when I'm talking about this, I like to really highlight is that sometimes when we think about the entire acronym LGBTQ, it's a misnomer in thinking that it's all one and the same identity. And it's an important, very important piece to remember that it's not. That when we're talking about the LGBT identity, we're talking both about gender, which we'll talk here in a moment on this slide, but also around sexuality. And that both are separate and unique parts of who each of us are. We all have a gender identity, a way we express that in the world, as well as we all have a sexuality, which we'll talk about more in a moment. So to start with, I wanted to highlight gender And when we think about gender, sometimes we do boil it down a bit too much. I like this kind of three-part explanation of what gender is. So it's basically thinking about it that there are three distinct pieces that altogether kind of create gender as we know it in our society. The first is biological sex. And this, 100% of the time, honestly, is based on the parts a person is born with. However, you'll see here, when we're talking biological sex, it's much more complex than just the external parts a body is born with. It does include those external parts, but it also includes internal parts that aren't visible to the eye upon birth. It also talks about the chromosomal combinations an individual is born with, and the level of hormones that that body has and produces. And the combination of all three kind of come together to create biological sex. I think the challenge that we see often, and this comes down to some societal beliefs and ways that we've navigated, people believe that biological sex is just about those external parts. And so, on a biological level, I think it's important when we're talking about gender to remember that external parts are part of it, but it's also internal parts, chromosomes, and hormones, and the interplay of all together. The next piece about gender that I want to highlight is gender identity. And this I describe as that internal sense of who you are when it comes to masculinity or maleness, femininity or femaleness, some combination of both or neither. That gender identity is something that is developed based on a variety of factors throughout your life, especially in childhood into young adulthood, and can be aligned or congruent with the biological sex, those external and internal parts, the chromosomes and the hormones a person holds. But it can also be differing or some level of incongruence with that biological sex as well. The third piece of gender I want to highlight is that gender role or expression. And this is entirely about how we navigate the world, both intentionally by choices we make, thinking about what clothes we choose to put on, what haircut we choose to have, what other accessories, jewelry, makeup, things that we intentionally take on. But it can also be unintentional things like the way we talk. Many of us, we have a way of speaking that is not as conscious or intentional a choice as maybe what shirt you wear when you wake up, or the way you walk or move throughout the world just physically. That oftentimes those are things that we aren't doing intentionally, but in our society and in many societies around the world, they can hold some gender association, expression, or role. One thing that I like to kind of highlight when talking about gender role or expression is it is entirely based on the climate, the context, and the environment that you're in. It changes over time. So if we think about kind of what was seen as quote unquote more masculine versus feminine in the United States 100 years ago versus today, we would see different roles or expressions kind of associated with that. Similarly, in different parts of the world, geographically where you live, there are going to be different gender roles or expressions that mean different things based on kind of that social contract that's there in that space and time. So again, just to review, when we're talking about gender, it is a complex interplay of all three of these parts. And kind of bottom line, I want people to take away that gender isn't as simple as oftentimes we'd like to believe it is, or oftentimes we're told. That even when we're talking about biological sex, it's so much more than what gets seen or identified at birth. And then you have these other elements. Gender is separate from sexuality, and kind of a cute mental way of remembering it I offer is that gender is who we go to bed as, kind of our internal sense and body and ways of expressing it. Sexuality, however, is the idea of who we go to bed with, or really the other oriented attraction and behavior that we engage in sexually. So just to talk a bit about sexuality here, I break it down into kind of three different components of it to help us understand. First, I start with attraction. And sexual attraction is really all about who you're drawn to, what you find attractive. Now, here we're talking specifically sexually, but attraction it spans many domains, including you can be attracted to someone's intellectual abilities or social prowess or professional aspirations. That there's a lot of other things, ways attraction can show up. Here with sexuality, we're really focusing on what we're drawn to sexually for ourselves. That's an internal process that oftentimes is outside of our conscious kind of drive or control. It's not something that I can say, well, I'm going to be attracted to X, Y, and Z today or tomorrow. It's going to be this way. It comes more innately from inside who we are and does develop over time. There's a lot of research that looks at how sexual attraction develops and what factors play into that. Different from orientation. How I describe orientation is it's how you as an individual define your attraction. And some of the terms that I'm sure many of us are familiar with, lesbian, gay, bisexual, these are all terms that are talking about that orientation, ways of describing or both to ourselves and to others how we define our attraction and how it shows up for us. Attraction and orientation are separate from behavior. And when we're talking about behavior, it's actually what are you doing? That sometimes there is an overlap of the behavior we engage in, matches up with our attraction sexually, and kind of aligns with some orientation we use to describe that attraction. However, it doesn't have to. I'll give you an example that people that engage in survival sex that they can be engaging in behaviors for functional reasons to survive, to get money for food, to have a place to stay, to find other protection or safety. And that may not line up with their attraction or even how they define that attraction to be. I've worked with many men and that engage in sex with other men, but don't find other men attractive and don't identify with an orientation of being gay or LGBTQ. So just something to think about that when we talk about whether it's gender or sexuality, there are complexities and nuances to each of these identities. And when we're thinking about the separation of attraction, orientation, and behavior, I want to invite you to really see those as separate pieces that do have interplay and overlap at times, but it's not a one-to-one thing. That if you know someone's attraction or orientation, how they describe that attraction, you can't always assume what their behavior may or may not be. I like this graphic. It was developed by the Trans Student Educational Resources. It's a free graphic you can get online, but it's a fun and clever way of conceptualizing a pretty complex topic when we're thinking about identity. And this is something that clinically I use with people of all ages as they're starting to understand and learn more about identity, but also as they're trying to understand how it applies to them. So I invite you to download this or go back to it if you find it helpful. So I want to talk for a moment just about some terminology out there. And I've been doing these workshops for probably almost 15 years, well over 10 years. And initially, when I started doing these workshops specifically around LGBTQ identity, I would come in with a 30-page glossary of terms, really wanting to give people the tools to understand. And as I've gone through that, glossary of terms has gotten less and less to where today I think I only have 4 slides in our webinar, partly because the resources are out there. You can go to Google, you can go to so many different books and resources. I'm happy to send them to you if you reach out to really find some working definitions when it comes to certain terms. However, I've stopped giving it because I find often when we have this glossary of terms, we rely too heavily on it. And I was seeing the impact it was having on the community, especially I work a lot with young people, young adults, queer and LGBT young people. And they were coming in saying, I keep hearing from people that they know and understand my identity when there's no way they could because they haven't asked me. So instead, what I encourage people to do when it comes to terminology, yes, have a base understanding and knowledge of what certain terms mean, but be open to learning from the person who's in front of you and really challenge any assumptions you might be holding and guard against coming in saying, I know because I've attended a webinar or I've read a book. Instead, come from a place of, I have some knowledge and some understanding, but I don't want to assume I know you. So, how about you tell me a bit around what are some words that you use to define yourself? How would you describe your identity and what does that mean to you? The other thing is that the kind of glossary of terms is constantly changing and expanding, which I think is just such a beautiful and creative thing, especially coming from our young people, where they're really dialing in with more nuance ways of describing different experiences that they are having. And again, going back to Alok's statement, when we can name things and be intentional around that, it does bring a level of meaning to our life that can open up levels of connection. So the other thing I'll mention that as we're going through some of the terms we go through today, or as you're hearing different terms or seeing different terms, I do really urge each of us to hold each term with deep respect because while all terms may not apply to everybody, each term that's out there, there is someone who it does describe an intimate part and vulnerable part of who they are. And as service providers, we have an ethical responsibility to hold that with respect and dignity. So first, we'll go over some kind of general gender terms, which often we'll see and I think are helpful to have a base working knowledge. First one is sex assigned at birth, and there are two different acronyms to describe the sex assigned at birth. If you think back to our gender slide, when we're looking at biological sex, sex assigned at birth really is just talking about those external parts or genitalia a person is born into this world with. A doctor, midwife, delivering person looks between the legs, sees vulva, checks off female, sees penis, checks off male, and kind of using the terminology of sex assigned at birth, AFAB for assigned female at birth, AMAB assigned male at birth. It does speak to more of the nuances of even a biological sex, that it's much more than those external genitalia or parts that a person is born with. You'll see this in medical documentation. It's something that as a clinical social worker in private practice working with a lot of clients, I use this language a lot in my notes and in documentation letters if it's needed for different reasons. Instead of saying, for example, they were born a male or born a female. Which really doesn't get into the nuances of biological sex. So that's why I encourage people to use AFAB or AMAB around the sex assigned at birth. Gender expansive is another term, and we can see it a couple different ways, non-binary, gender creative, gender fluid. Now, each of these can mean something very specific to individual people who that resonates for their identity, but as a kind of a general definition, gender expansive is talking about a gender identity and experience that's outside of the binary gender model that for many of us we've grown up in and are still steeped in our society. That binary gender model is the assumption that if you're born with a penis or a vulva, you're going to identify as a man or a woman, you're going to be attracted to the opposite sex and be in relationships kind of throughout your life in that same way. The gender more affirming or expansive model really looks at that there are infinite possibilities for each of those when we take into consideration some of the nuances at play when it comes to biological sex, gender identity, the way we express it, the way our attraction forms and develops, the behavior we engage in. So again, just some terminology that I don't want you to take as kind of gospel from this workshop that this is the only definition, but in general, when we're talking gender expansiveness, we're talking about gender identities that are outside of the binary model of gender. Some other terms, gender terms to know, transgender, often abbreviated as trans. Trans comes from the Latin origins, meaning roughly on the other side, and it's looking at your assigned gender, again, entirely based on external genitalia, versus your gender identity or that internal sense of who you are, male, female, masculine, feminine, or a combination of both or neither. Transgender often means that there is some incongruence between that assigned gender and the gender identity. Cisgender, however, again, coming from Latin origin, meaning on the same side of, and again, looking at the assigned gender versus the gender identity, and there's a level of congruence where your assigned gender matches with your gender identity. Just a note about cisgender, it was a term that came from the trans community as a way to provide a bit of equality between terms. Previously, the trans community was saying that many people would say they're the trans community and then there are quote unquote normal people. There's a cis normativity that they're trying to move past to kind of say that identity when it comes to gender isn't just surrounding cis people, that there are multiple ways gender can be, there are multiple experiences people do have and have had throughout history, well documented. And so again, I do encourage people to, when they're thinking about gender, use both transgender and cisgender. Here's a slide with some examples of those in use and kind of the meanings behind them, again, going back to the Latin term. So switching gears a little bit into some terms, sexuality terms that often we see, we hear, and would be good to know. Again, I urge you, take this as the starting point, not as the finish line when it comes to understanding terms. When in doubt, ask. Be curious with the people you're working with or the communities you're engaging with. Asexual or asexuality, sometimes seen abbreviated as ACE, it refers to someone with little to no sexual attraction to others. Something to note about asexual individuals, that doesn't mean that they may not experience romantic attraction or other forms of connection or attraction. It's really speaking about kind of the little to no sexual attraction. It also doesn't mean that they have zero sexual attraction. It could just mean that it's on a different kind of space on the spectrum of attraction than maybe another person would have. Bisexual is a term that describes attraction to more than one gender. This doesn't always mean that that attraction is to more than one gender at the same time, which I think is a misnomer. Sometimes people will say, well, bisexual people, I've heard a lot that, especially in relationships, the fear of not being trusted or feeling like, well, if I can have an attraction with more than one gender, then it means I absolutely will have an attraction with more than one gender. Something I like to tell people around that is how many of us have gone on dates or interact with people that we have zero attraction to, even if they're the gender that we typically do find attractive. So just to kind of as another reminder that just because we can find attraction with more than one gender doesn't mean we will or always do, and definitely not at the same time. Pansexual, sometimes abbreviated as pan, this speaks to an attraction to people regardless of gender. And with a lot of my young people and young adults I work with, when we're talking about sexuality, pansexual is a term, especially in the DMV area, I hear people resonate with quite a bit. So it's a good term to know and understand. The last term I want to go over here on sexuality is homosexual. It is a dated term that often in research and some more clinically oriented literature you may still see. When working with a community, it is a term that can be offensive and very objectifying of people and their experiences. So I encourage people, instead of saying homosexual, replace it with gay or LGBTQ, kind of as an umbrella term to talk about a sexuality. You can also say same gender, loving individual, or again, when in doubt, ask the person you're working with. But as a general rule, I encourage people to steer away from homosexual. Queer is another term that I think is important to talk about and understand a bit about some of the historical connotation. So historically, within the LGBT community, queer was a term that came with quite a bit of violence, quite a bit of slurs, quite a bit of abuse, and often death connected to it, especially in the 70s, 80s, and especially with LGBT men community. That queer was often a target, not exclusively, but historically, that's where a lot of the harm was done. In the last 20, 30 years, the community, LGBT community, has gone through a process of reclaiming it, of trying to take away the negative association with it from the history, not to erase it, but to use it as a word of empowering. I like to think of it as more of an in-group term, a term that unless you're part of that community, don't assume you have the right to use because of the historical connotation. I think you never can assume that a person you're working with, unless they've given you some permission and buy-in to use it, is okay hearing it. For an example, I used to run groups with older gay men, and it was a conversation we would have often around how there was a visceral reaction many of the group members would have when hearing, especially the younger generation, identify as queer or talk about the queer community, because for them, their real experience of hearing that word was often paired with abuse, with assault, with violence. And so for them, it's a term that it's just not something that's kind of either in their vernacular, but it also is something that it activates such a visceral negative association to experiences they've had that they don't want any part of it. So when you're using it, always kind of keep that in mind. Kind of how is it used? I've seen it used in two ways. One as a general kind of umbrella term synonymous with LGBTQ. So instead of saying the LGBTQ community, one might say the queer community, meaning kind of the same thing, talking about both identities of sexuality and gender. But it can also be used to describe or define a specific gender expansive identity. For example, someone might say, I identify as queer, meaning my gender identity is outside of the binary model of gender, and queer is the term that resonates most closely with my experience of my identity as I'm coming to understand it to be. So again, helpful knowledge to understand that queer can be used in these two ways, but I do urge caution with people using it, especially if you're not in the community. But even when I think about in-group terms, I think about I myself identify as a queer man. However, I work with a lot of adolescents and 20-year-olds. I'm not an adolescent or a 20-year-old anymore, and so I'm not in their group. Similarly, when I'm working with elders in the LGBT community, I'm not an elder with all the lived experiences, so I'm not in their group. And so again, not assuming just because I use it or I'm part of the LGBT community broadly, that group, specifically age in this example, that I have buy-in to use it. So always looking for that or asking for it. So we're going to shift from some terminology to talking about some of the social determinants of health. There's a plethora of research out there really looking at LGBTQ individuals' experiences with some of those non-medical factors that contribute to specific health outcomes. Today, because of our time, we're going over kind of a very surface level. But if you're interested in any more of the in-depth research, the statistics around it, please reach out. I'm always happy to share that with you. So the first piece we'll look at is the economic stability, that it is well documented in research that for LGBT people, there is a different economic stability often. Again, not always, but often. And the ways that it shows up is job discrimination, the fear of being discriminated against. It was only until recently that we had some legal protections. However, legal protections are different than actual experiences, and always keeping that in mind, that even if there is protections and kind of steps someone could take if they are being discriminated against in a workplace because of their LGBT identity, there are also many barriers why they may not ever feel safe or comfortable in taking those steps. Um, in addition to job place discrimination, there are wage gaps. Again, well documented that LGBT people often don't make the same in certain roles or industries as non-LGBT people. Housing instability and homelessness is another piece that is very prevalent in our LGBT community. I know this is a bit dated statistic. I can't remember when it was from. It's at least 5, 7 years ago. But it looked at kind of the rate of homeless youth in DC compared with national, and the LGBT identity of youth, the youth that identified as LGBTQ, was more than 50% of the homeless youth in DC. That was above the national average of homeless or housing insecure LGBT youth nationwide. So I have some theories around that. I think that there was a time where the message to LGBT young people was to come out, move to the largest city. However, it was an influx of people that the services couldn't support, and you ended up with a bunch of homeless young people in cities. So just again, another thing to think about, that if some of your basic needs aren't met, especially when it comes to housing, there is less ability for you to navigate through different developmental steps and to find some security, which definitely has impacts on health outcomes. The last one here is that LGBT individuals often are at higher risk for poverty, often linked to an experience of family rejection. And there's a lot of research out there looking at the impact of family rejection has on health and mental well-being, specifically for young people, because there really is no replacement, a one-to-one replacement for a family of origin, that there are support factors, and there is research to suggest one positive adult influence on a young person's life can reduce some of those risk factors by 50%. However, that's not the same as having a family acceptance and embrace of you. Other social determinants of health, you have educational access and quality. For LGBT individuals, they do experience higher rates of bullying and harassments in schools. There's also a lack of LGBTQ inclusive curriculum, which we're seeing increasing in the United States recently. I'm filming this in 2025, so just thinking about some of the social constructs going on politically in our country and some of the movement away from more LGBT inclusive curriculum. But that has an impact, that people thrive when they see parts of themselves represented in spaces and places and learning. And for our LGBT young people who are coming into their identity, when we're not talking about it, when we're not normalizing it, when we're not giving visibility in schools and in curriculum, that impacts their ability to learn and be present cognitively, mentally, and sometimes physically. Which brings us to the last one, that for many LGBT young people, the school push out is quite high. And that means not just push out in the way of expulsion or suspension, which is true. There's a high correlation with LGBT identity and entering into some educational disciplinary action based in school settings. But also, if the health is going down, then they're not able to be at school, or if they're fearing for their physical or emotional well-being or safety. I have many young people who have shared that they skip school. And again, some of the statistics out there support that as well. Specifically true for trans athletes, when I'm sorry, trans students, including trans athletes, but for trans students who the space is becoming narrower and narrower in certain educational spaces for them to even exist, it directly correlates with their felt sense of safety and their ability to engage in the educational environment that's there for them. Healthcare access and quality is another social determinant of health that LGBT people do have some significant limitations when it comes to accessing uh, healthcare, but also quality healthcare. One is thinking about who are the providers providing the care. Not just is there an understanding of LGBT identities and an ability to meet a person where they are without making assumptions on that, but also are there providers that are openly identifying as LGBTQ? And I understand some of the constraints of that, especially based on employment space. However, there are ways of communicating things to people who know that know. For example, I went to, it was actually a, a vet appointment for my cats. I took them there, and the vet noticed that I always wear a rainbow bracelet. And she noticed it and she said, I really like your bracelet. That was all we said. And it was our own way of saying, hey, I know this is an identity I share and I hold. Fast forward a couple months later, I was actually at a Pride event and ran into her with her wife, and we were able to have a deeper conversation. But stuff like that matters, especially in professional settings where you might not be able to be open and out around your identity, and it might not be appropriate based on where you are and where your work is. However, small visual representations of not only this is a safe space, but I'm thinking intentionally around the impact of having this bracelet or having a small rainbow pin or having a magnet that says safe space, of what it means to people who it would mean a lot for. So visibility is important. When it comes to healthcare access and quality, LGBT people also have a high rate of refusal in accessing certain healthcare or receive substandard care. I did about 10 years ago a research with a series of focus groups with LGBT young people, young adults into kind of early 30s, kind of understanding what wellness meant to them and experiences specifically in medical settings. And this was a theme that came through loud and clear, that providers would come in and once they learned of or an LGBT identity was disclosed, certain assumptions were made that then impacted the care they were able to receive. I had one young person I remember say, I went in because I had sprained my ankle, and on the form I had marked that I'm gay. And the provider only wanted to talk about safe sex and HIV testing and prevention, which was not at all on my radar or relevant to what I was coming in for today or my life. I was coming in because I had sprained my ankle. So again, that's an example in a small way of substandard care. I think historically we go back to especially the trans community, trans individuals. Western healthcare has really used and abused them. That trans people for many years, still in some cases now, some cases more now based on what's going on in 2025, are being used as guinea pigs and scapegoated for a lot of things, which again impacts the care they're able to get. Which kind of leads into the last point around healthcare, lack of gender affirming services. Even just the knowledge that a place doesn't provide that can decrease access in other areas. It decreases the trust and the faith in a healthcare system to support, to see, and to provide evidence-based care for individuals. And then lastly, some social and community context when we're talking about social determinants of health. Family rejection, we mentioned this earlier. It has huge impacts on not just mental health and wellness, but also physical health and wellness. There's a lot of research that supports with family rejection, your rate of suicidality, your rate of depression, anxiety, but also cardiovascular disease and sleep disturbances, which have high correlation with other health challenges and issues goes up. LGBT people often have weak support systems. I know at the beginning of our webinar, I had mentioned how isolation is a very powerful thing and a pervasive thing within our community. We know that we all, to survive, need connections, specifically connections of belonging. Isolation takes that away. And for many LGBT people, especially if they've felt and experienced some level of isolation or rejection at an early age from their families, kind of the space where you're starting to understand and experience what support feels like, it can have impacts then, but it also impacts their ability and openness to believe those positive connections and supports are possible in the future. Minority stress or the experience of ongoing sustained stigma and discrimination has real impacts on health outcomes. And then I like to talk about the exclusion from faith and cultural communities, which is a big one. All of us hold many identities, that we're not just a single identity. And for many of us, our faith and cultural experiences, traditions, and communities are important parts of who we are. Unfortunately, that for many faith-based, and we're seeing some shift here, but especially within Christianity in the United States, there has been a very explicit exclusion of LGBTQ members and individuals in that community. Similar to different cultural traditions that we see around the world and experiences that people bring that oftentimes, not always based on a faith-based belief system or practice, those cultural communities can exclude or shun individuals once an LGBT identity is shared, disclosed, or assumed. I've definitely heard of many experiences of people being excluded just because someone thought they were gay or queer or trans. So just some things to think about, the barriers that could impact our LGBT clients that we're working with and experiences that they may be coming in to the work even before they get connected to us. What are the outcomes? I mentioned this a bit already, but just you can see it here on the slide. Depression, anxiety, increased substance use disorders, increased suicidality or suicide attempt. Cardiovascular disease is at an increase within the LGBT community. Chronic pain is another one. Disrupted sleep cycle or sleep disturbances is another one, which has real health outcomes as well. Some additional barriers to services that our LGBT community and individuals often face is a fear of discrimination. Whether or not an individual has experienced it themselves, oftentimes community stories kind of are shared, and there's this knowledge of experiences that other people have had, which can negatively impact a person's ability to, again, feel like they can trust a system or even be open to taking that risk. Because, well, what if I go in and they aren't using my name, or they don't ask me what pronouns I use and make an assumption based on maybe my presentation that day? Or what if I go in and once they find this information out, their demeanor might shift and they may not be as curious around what's going on with me or open to a collaborative process or understanding kind of the ways that my experiences may show up and impacting the services I'm coming to seek right now. There are real financial barriers that our LGBT community often is underinsured, or just I know we had spoken about some financial limitations based on family rejection, but also job prospects or the ability to make a living wage in certain areas goes down. Uh, Another barrier is just the knowledge of competent services that are out there for LGBT people. Sometimes they are so focused on survival, whether it's a physical survival or emotional survival stability, that there's not a lot of space to know or to seek out certain competent services. Oftentimes, kind of in the mental health world, I talk with families and individuals that are just so overwhelmed with how do I even find a competent service provider? Where do I even look? Timothy, what are some questions I should even think about? And so kind of in my role, oftentimes I'll give them scripts around, well, here are some resources on where you can go. Here are 2 or 3 questions you can ask to kind of vet and find out, is this someone who it would be safe to talk about my identities with, or is this someone who wouldn't? LGBTQ visibility, we talked about the power of visibility, and conversely, when that's not there, the impact it can have. Normalization and internalization of trauma. For any of us, for us to be willing to seek and accept help, we need to understand that there's something going on that we need support around. For many people, LGBT people, I do think that there has been a normalization or even some internalization of what I'm experiencing isn't really trauma. This is just the norm. This is the expected, and I'm going to make do with it. I believe that comes from a survival state. That comes from such a protective mechanism of to realize that it's not right and I deserve better means that I have to face the reality that I'm not getting that. And so kind of trying to internally convince ourselves that no, this is okay. Like doesn't every family kick you out at 13? There's nothing wrong with that. That I do think that much of this happens at an unconscious level for a very protective reason, but it can produce other barriers from LGBT people accessing supports. If they don't think they need anything, they're not going to seek things out to support them. And then the last one kind of ties with some things we've talked about already, but the real or perceived negative experiences that they'll have if they do seek or ask for help. And again, I want to highlight the perceivedness of this. They don't have to have ever had a negative experience, although I will share in my own experience working for over 15 years in the field. Most LGBT people that I come in contact with have had at least one negative experiences when it comes to mental health care or medical care. But it's even just the fear of, hey, I heard a friend have a negative experience talking with a doctor about this that could create a barrier keeping someone from then actually talking about it. I know we're coming up, excuse me, coming up to the end of our time today, but I do want to take a few moments to just go over some trauma-informed care principles. These come from SAMHSA. They were developed about 2 decades ago. About 10 years ago in 2014, they were updated to include I'm sorry, to include six principles. And I think it's a good lens to look at as we're thinking about, all right, we know what the barriers are. We know what some of the statistics say around this community, but what can we do? It gives us kind of a step-by-step approach around how do we explore bringing each of these into every interaction with each person, regardless of identity, but specifically to increase the accessibility for our LGBT community members. So just to go through it quick, we'll go through each of these and kind of talk about some specific strategies that we can do to promote this with our LGBT community members and individuals. So for safety, thinking both about physical safety but emotional safety, how do we create the space both in our verbal interactions but also in our forms to let our clients self-identify their name and pronouns? On intake forms, do you have a place for legal name if you need it, but then also name a client uses? Make two separate fields for that. Is there a question that asks what pronouns do you use? And then how are we building it into our documentation system and our workflow to be able to use the self-identified name and pronoun consistently at every interaction? That is one of the things that for many of my LGBT clients I work with, specific my trans clients, that say will make or break their ability to access care. That if they get a form and it doesn't have kind of legal name and name used or doesn't ask for pronouns, it messages to them, hey, may not be a space that's safe enough for me to get the support that I need. So how can we promote safety? One way is to think intentionally around where are we asking this information, and then how do we support us using it consistently. The other is ensuring that the space is visibly LGBTQ affirming. How do we do that? We talked earlier about just some visible reminders of, hey, you're safe with me, but it can also be in the space flags, signs and policies. In my office, I have a non-discrimination policy posted, framed, and posted in the waiting room where our clients and families wait. And in it, explicitly states that in this space, all identities, sexual orientations, genders are welcome here, in addition to a lot of other things that are there. I've had many clients say that by walking in the first time and seeing that and reading that, it just allowed them to relax a bit more, confirming for them that this is a space that they can be. So stuff like that matters. And it doesn't have to be rainbows only, although rainbows are great. Also thinking about restrooms in your space. How are you creating space for gender neutral restrooms? And excuse me, this can be in restroom signage, but can also be in what you have accessible around single stall restrooms. Again, in messages, this is something we thought about intentionally to optimize safety for all people who enter in. And then when you see harassment or microaggressions, uh, name it, address it, don't avoid it. That even if you're not doing it to someone who has disclosed an LGBT identity to you, you never know who might be listening or watching and what that might mean, and seeing you slow down to say, hey, we're not going to use that slur here. That's a slur that can be disrespectful. And in this space, we really want to optimize safety for everybody. Can be a way of just kind of naming it and acknowledging it and providing a little correction in those moments that has big meanings and for safety. Trustworthiness and transparency. For all of our clients, but especially our LGBTQ clients, we need to clearly explain what our policies are and any limits around confidentiality. This goes to both kind of what you're required and mandated based on the role you're holding, thinking about mandated reporters, but also when you're working with, let's say, a trans client, what are the limits around where you don't have to and where you might need to share a trans identity? Or when it comes to sexuality, same thing. Are there spaces based on the work that you're doing that some of this information may need to be shared or may come out in ways that kind of take some not rights away, but some ability for the client to hold that information as private, takes that away. Oftentimes, this is in legal services, that there are some kind of thresholds that once you meet, certain information kind of leaves the hand of the client, and kind of other steps are taken. So you just want to be very clear with yourself what those policies are based on your role and the work you provide, but also communicate that quite clearly and explicitly to your clients. Thinking not just about the limits of confidentiality, but what are the services you're providing and what are the limitations there? Don't overpromise. Like, I have clients coming in, and oftentimes I have clients coming in seeking gender affirming services. I can't sit there and meet with a person and say, I will guarantee that you can get the medication you need, because that's outside of my control. What I can say is, I know the system, I know the steps, and what I could do is I can walk through it with you. I don't always know what we're going to encounter based on what your insurance is, based on your age, based on the policies of different healthcare settings. And so being very clear with yourself first, but then communicating that to the people you're working with, what your services are and the limitations of those services. And then also invite and involve the client very early on in your work together in collaborative decision making. Oftentimes, when I'm working with clients, I kind of start with a framing of, hey, I see you as the expert in your life and your experience. I know the work I do, and maybe I know some more resources or ways to navigate through those, but you know you better than anybody does, and that's important here. And because you're the expert in you, your viewpoints matter. Your thoughts are significant in us figuring out what those next steps are. And so I'm going to invite you to share things. And I also want you to slow me down. If I'm suggesting we do something and it doesn't make sense to you or you disagree, let's talk it out so that we can really co-create this space together. That can really message to them increase trust and also transparency. And I'm not making decisions on your behalf without us fully understanding it together and having a space to talk through it. Peer support. I love this. This was an addition in the 2014 kind of trauma-informed approach that SAMHSA put out, but it emphasizes that community connections and connecting with those with similar lived experiences matters. For our LGBT community, especially when we know that isolation is high, yeah, I think it's vital that in whatever role we're in, this is part of our work. How do we explore what community connections they have, and how do we help build those up? Uh, and here are a couple examples of it. You have peer-led services that perhaps in your organization or agency, you could explore putting together some sort of groups with LGBT facilitators or formalized mentorship programs with maybe you have an LGBT client who wants to work with a newer client and kind of help them understand along the process. But it can also be in less formal or informal settings of, hey, do you know about the DC Center for the LGBT community? It's a great space for community members to connect with other community members that maybe share an identity and maybe have some similar lived experiences. Uh, Also, in person is great. As a mental health clinician, I see there's no substitute for that, especially coming through a pandemic where many of us had to go virtual. But virtual is still connection, and to kind of understand both have value in building out that peer support can be helpful. There are a lot of online communities where for LGBT people of all ages to connect and kind of bolster their own networks. I like this quote from Bell Hooks talking about the importance of belonging. Belonging is a place where we find our true selves, a place of radical openness where all of who we are is celebrated and affirmed. Belonging often is found when we're in spaces and places where we see ourselves represented, whether it's with people with some shared identity or some shared lived experience. Not all, it's not going to be a one-to-one kind of crossover all the time, but it helps promote and foster belonging, which helps us come into our more true self and helps us navigate through life in a more engaged way. So another tenet or principle of trauma-informed care is collaboration or mutuality. We spoke about this earlier around the trust and the transparency, but seeing the clients as the expert in their own experience and communicating that explicitly, saying, you have wisdom here and your wisdom matters. That wisdom is what's going to be helpful, pivotal in the work we're able to do together. That really fosters a collaborative space, a co-created space, and really engages and empowers our clients in a meaningful way. How are we thinking about what are our goals that we are setting, and can we make them collaborative? Really listening and taking into account feedback that clients say. If you have a client that comes in and maybe I have a set of kind of things that I want for this client, but the client says, my real goal is I honestly I don't want a restraining order out. I don't want to do any legal things. All I want to do is I want to be able to wake up day in and day out and take care of my kids. I don't want to talk about this. I just want to be able to keep moving forward. That's important information for me if I have a survivor coming in to say, hey, you do have options, you do have rights, but you also have the ability to kind of set what your priorities are for where you are right now. And I'm going to hear you and work with you to meet those goals. I think here it's important to acknowledge there is some inherent power imbalances when you have an individual seeking us out as a helper or a service provider, that oftentimes, for a variety of reasons, they come and saying, well, tell me what to do, and how can we intentionally acknowledge that, but also work with that in our space and saying, yes, I know some things, but I don't know you and your experience, which is as important as maybe the resources or the knowledge of navigating through different systems that I hold. So together we can create kind of this beautiful blending that will get you ultimately more out of this exchange and the support than if I were just to say, do this, this, and this, and then you're good. And then also outside of the individual work with clients, are organizations partnering with LGBTQ-led organizations? Are we looking at collaborations around here in DC? We have Whitman Walker, a healthcare center that came out of supporting the LGBT community and does a lot of work with that still. Are we asking them to, hey, we're wanting to start this new group for LGBT survivors. Can we talk? Or can we have a co-facilitator from your organization come? Are we meeting with the DC Center to talk about maybe the policies we have? Are we working with HRC to look at how are we set up as an organization? Are we taking into consideration LGBT identities, not just for the people we serve, but the people in leadership and our hiring practices? So there are multiple ways for us to partner in a way that really embraces the collaboration and mutuality from a trauma-informed lens. Empowerment, voice, and choice, definitely important, especially with LGBT identities. And it starts with affirming identity and transition goals, but also boundaries. If you have someone coming in and saying, hey, I identify as queer, but I don't want to talk about it, don't keep asking them about it until they bring it up. Message that we can talk about it, but I'm also going to respect if you don't want to, and that's okay here. Um, Offer options around service delivery. It's a beautiful thing coming through the pandemic that I think many of us do have a deeper experience and knowledge on how to do good work virtually, whether it's over phones or telehealth, making that kind of an option for our clients, depending on where you are and if it makes sense. But more options are better. Giving them a menu of options really empowers them to make choices based on what they know to be true for themselves. And then support self-advocacy and other systems too. They may be coming to you to navigate a legal system, but they may also be interacting with a healthcare system. In your role as a legal advocate, you can also connect them with resources or even just let them know what's possible to help in navigating healthcare as well. And then lastly, the sixth principle with trauma-informed approach is cultural, historical, and gender issues. For me, this really talks about the taking intersectionality into approach, understanding that we all come with many, many identities that make us who we are. Don't assume that only one is what's important, but understanding how they interplay with each other. But also acknowledging how systems of oppression have and continue to impact, especially our LGBT individuals. So kind of thinking through with this, I often go back to policies. What are the systems that we are holding up and reinforcing? And do they take into consideration some of these elements at play? So I know we're here wrapping up our time together, but do want to just go over some both local and national resources. The DC Anti-Violence Project is a project out of the DC Center that really looks at advocating for social and political change around that. They do some really good work. VPART, Violence Prevention and Response Team, is specifically about a response to individuals, LGBT individuals who've experienced violence in any form. The QR code will take you to a Google form. Again, this is run through the DC LGBT Community Center. That QR code will take you to a Google form to just ask for more information and get connected with people at the DC Center. Some other DC resources, you have the DC Victim Hotline, a very helpful resource tool that can connect you. The hotline's not specifically for LGBT individuals, but they do have many LGBT-specific resources there. DC Rape Crisis Center, of course, and then Volair, formerly NVRDC, is another one that I think is important to know about when we're thinking about supporting survivors and victims of crime and violence in the district. Some national resources, you have the Trans Lifeline. They have a website with some great resources on it. It's also a 24/7 hotline specifically for trans people, by trans people. They also take a very intentional approach to what emergency services they activate, understanding that for example, police with the trans community has a history that's fraught with violence and discrimination. And so kind of not saying that the first go-to line of support is for us to call and activate police or ambulance to your space. Thinking about how are other ways, if you're calling, we can kind of de-escalate, explore resources, maybe even engaging in a less formal resources to give you the support you need, community-based resources, without activating something that could put you in more danger. SAGE is a national organization focusing on advocacy and services for LGBTQ elders. Great organization. They do have a hotline as well that you can call for various things. Again, it's another resource for our elder LGBTQ individuals to connect around their specific experiences. The Trevor Project is for 25 and younger. They have a 24/7 hotline and again, a website full of resources. A note about that, just recently in July of 2025, unfortunately, the National Suicide Hotline got defunded for their LGBT specific services and supports in their hotline. So it's even more important now that we know about the Trevor Project and are getting this number out around the work that they're doing, because the National Hotline for Suicide Prevention doesn't have that as a component anymore. And then the LGBT National Help Center, again, has a hotline, but also provides a lot of online resources specifically for LGBT community members and for those supporting LGBT community members or individuals as well. I want to end with this quote by Dr. Meg John Barker, a writer, speaker, and scholar, that isolation is the dream killer, the soul crusher. Queerness survives and thrives only through connection, through chosen family, solidarity, and community. And as we're wrapping up our time together today, I just want to say that we've been in community here. I know this is a pre-recorded webinar and we're not able to interact in a live way. However, by being here and by listening to this, by thinking about your work, perhaps in a new way with some of the things we've gone over, is a way of standing in solidarity with the queer community, but also in fostering a wider sense of community for all of us. I want to thank you for spending the hour with us today. I would encourage you to fill out this workshop evaluation. It's very helpful for the DC Coalition to End Sexual Violence, understand what you got out of this, but also understand what are other workshops or topic areas you'd be interested in. Here is my contact information again. And then DCCESV is always looking for people who would like to either provide a training or for groups or agencies wanting to receive some training and more technical support, and feel free to reach out to Elizabeth Olds. Again, thank you for spending this hour with me, and I look forward to ongoing learning and connecting. Take good care.